The Full Exposure Podcast is brought to you by Metro Health, University of Michigan Health, and Dr. Peter Hahn, in appreciation of the creative and artistic visionaries who enrich our lives through cultural connections. Hey, everybody. Welcome to another edition of Full Exposure with me, your boy, Brian. If you're a regular listener to this podcast, you probably know that my family has navigated a medical crisis or two in regard to our girls. We've been fairly frequent flyers to our hospital systems here in West Michigan. And I was especially excited to be able to sit down with Dr. Ron Grifka, who's, quite frankly, a man who has probably as an impressive medical resume as probably any doctor in the country. At his core, Dr. Grifka is a man who's dedicated his entire life to repairing the hearts of children. And if you think about that just conceptually for a second, you have kids, babies, infants, small children, up to teens, that the engine inside of their bodies, their hearts, aren't working properly. They need repair. And Dr. Grifka is a man who's done thousands and thousands and thousands of heart surgeries, heart catheterizations. And I was especially interested in this intersection because of our experience as parents of kids who need help sometimes. His interaction with children and families is at a point where they need his very specialized expertise, and they're facing a lot of uncertainty and doubt when they meet Dr. Grifka, and especially at a time when some of their very toughest days and weeks are right in front of them. And so I was very pleased when I was talking to Dr. Grifka, and I only met him briefly on a video shoot. I had no personal interactions with him and didn't really know him at all. But when he came to the studio and we got involved with this conversation, I was just pleased that I didn't meet a walking resume. I met an empathetic, compassionate, caring, very impressive man with a deep heart, no pun intended. But I think when you repair hearts and you dedicate your life to saving and improving the lives of children's hearts as a pediatric cardiologist, conceptually you probably have a pretty decent heart in there as well. But in this episode, we talk a lot about Dr. Grifka's dedication to these families at a very important crossroads in their lives for their kids and for their family, and what carries Dr. Grifka through both the good and bad days of being a doctor. And I was especially intrigued with this moment, this unique pressure that he feels when he's doing a surgery or some other type of procedure on a child's heart where they intentionally stop the heart so they can perform a procedure. And it takes, it's about 5 seconds where they intentionally stop the heart of a living child, and then they hope that the heart starts up again once the work's completed. And I became very fascinated with that moment and just what that must be like. But hey, we also talk about Texas barbecue and France, and there's a whole guy there. And I just really was, I really liked Dr. Grifka, and now he has Chief Medical Officer at Metro Health. Dr. Grifka oversees over 500 doctors and 17 different departments in his role as Chief Medical Officer at Metro Health, University of Michigan Health. So let's explore the bigger picture now. Let's dive in with Pediatric Cardiologist, Chief Medical Officer at Metro Health, University of Michigan Health, Dr. Ron Grifka. So we're officially rolling, Dr. Ron Grifka. Okay. Nice to have you here. We just did a nice little photo shoot, and it was fun. And I kind of put you through literally some paces. We experimented with a little bit of long exposure photography. We'll see how it comes out.
Well, thank you. It's a pleasure to be here, and look forward to chatting with you. And talking about the world.
Yeah, I'm really excited because you're Chief Medical Officer at Metro Health, who is our number one underwriter and a great partner. I have to say, between Dr. Hahn and your entire staff, our relationship here on this podcast has been phenomenal and allowed us to do things that we wouldn't be able to do as just a little one-man band podcast. So,
well, thank you. We've got some great people at Metro Health, and it makes it easy to talk about.
Yeah, it's a good, yeah, for sure. I'm impressed with the culture, the association with University of Michigan Medicine, which I think everyone knows is a top tier medical brand, research hospital, all the things you want. Maybe you can just quickly off the bat, and I want to get back to this little lead-up conversation we were having before the camera started, but just talk about the horsepower that maybe U of M and that sort of a collaboration that happens with Metro Health, because Metro Health started as this small little regional community hospital, and now there's major affiliation. So from your perspective, what's great about the U of M Metro Health collaboration and partnership?
Well, I was on the faculty at the Mott Children's Hospital in Ann Arbor for 8 years, and then spent 2 years as the liaison between the health system in Ann Arbor and Metro. And then for the last 2 years, I've been the chief medical officer. But certainly being firsthand knowledge of how the health system in Ann Arbor, University of Michigan works is very helpful. But you see, being able to translate some of those techniques and skills and procedures here to West Michigan is very helpful. There are some great doctors, great nurses, great therapists here at Metro, and to be able to bring some additional new techniques and operations and different procedures to advance the care in West Michigan has been very helpful, very enlightening, and very rewarding, to say the least.
Full disclosure, my oldest daughter, Hannah, just graduated from U of M, so she's an alum. I'm actually leaving this afternoon. I'm going to go pick her up. She graduated a semester early, which we're very proud of and grateful to her for. But also, but she's living in Ann Arbor now, and for the rest of this lease that we have, of course. And she wants to walk in the spring when her classmates and all her friends, graduate. So she's postponed her graduation till May. But anyway, I'm going to go pick her up. She's going to come home for a long weekend. And
congratulations to her, and of course, go Blue.
Exactly. Well, I know you're a proud East Sider too. You went to Wayne State.
I grew up in inner city Detroit, right by City Airport.
No way.
I did. Yeah. Then went to Wayne State University for both undergraduate and medical school, and then did my residency at the Children's Hospital, Michigan, in downtown Detroit.
No way. That's fantastic. So. But in that, I'm just curious. So you grew up in the city of Detroit. So what was growing up like, and what did your parents do? And then now you're a doctor. So what were some? Just give me the landscape of like how you were raised in Detroit and what the dynamic was with your family.
We were about 3 blocks from City Airport. Neither of my parents went to college. My father worked on the assembly line at Chrysler for 48 years.
No way.
Yeah, and we had 6 kids. I was the 5th of 6.
Okay.
And I had a lot of hand-me-downs from my 2 older brothers.
Yeah, you did.
But nonetheless,
you made a good living in that era, I'm sure. Unions and working on the line, there was good things. But like you got that many kids, things get stretched.
It was kind of tight. You're right. And then, as I mentioned before, I'm the 5th of 6 kids. My younger brother, Mark, had Down syndrome. So it certainly changed the family dynamics and was probably part of the impetus for me to go into medicine.
Okay. How much younger is he?
He is 6 years younger than myself.
Okay, so you were, you knew your brother was different, when he arrived.
It was interesting. Well, back then, in mid to late 60s, he didn't start walking until he was 4. Okay. And it was about at that age they actually diagnosed Down syndrome. They didn't know much about it back then.
Yeah.
Whereas now we know in utero diagnosis and soon after birth. But he was just, why isn't he walking at 4? My brother's supposed to be walking. And it was it really changed the family dynamics. And you see how my parents really adapted to really devote everything to take care of him, which they certainly should have done. And they did a great job doing it. But
I'm just curious how it prepped you, having a brother with Down syndrome and special needs. Did that create an extra door of empathy for when you were caring for families and having a little more of a window into a family member who's maybe not like the mainstream population?
Oh, absolutely. It's I thought as Mark was going through a number of tests and evaluations, I always thought the physicians and the healthcare system really could have done a little more for Mark and for my parents. Mm-hmm. And I thought as I went into medicine, I can do better.
Yeah.
And so every day I hope to do better, and we probably do spend a little more time with these families, with these patients. I know what they need and what can be helpful to them, and it doesn't take a lot from me to provide that, but a little extra can go a long way to these families and these wonderful kids.
Well, and I was sharing a little bit about our family dynamic with 2 of our 3 kids have, been pretty frequent flyers. And Maddie is doing wonderfully. He's 19, has type 1 diabetes, and Faith had a stroke in utero, so she had crisis before she ever came into the world. So we've been through it a lot. We've learned to advocate and ask questions, and I think the challenges in a healthcare system, and I think what you're alluding to earlier in your answer was just, you can easily, if you don't feel like you can be proactive and advocate for yourself and ask the type of questions, and pushback's the wrong word, but strongly being an advocate, especially for children, your children, you can get herded through a system and kind of like everything's kind of hunky-dory, but, if you don't have the agency or feel you have the power to ask questions, sounds to me like, in your practice, you might welcome some of that exploration around the edges of what you're thinking. No,
certainly. I look forward to questions from parents. I hope if I do my job correctly, they don't have any questions. I've answered them all before they come up with them, but certainly, even with my best preparation, they do have great questions and other things that I may not have thought about. But, another minute or 2 of my time is, hours to them.
Yeah.
And it's just so helpful to make sure that they leave there with all their questions answered, feeling comfortable with what we're discussing. Some of the discussions aren't necessarily fun or enjoyable.
Well, and I have so many questions for you. You told me I could call you Ron, so I think I will for this. It's easier than Dr. Grifka.
Sure.
But Dr. Grifka, that really is, what I admire most about doctors and people who are at the forefront, you might go through a day where you're breaking not so great news to people 2-3 times a day or a week or maybe more sometimes, and then there's times where outcomes aren't what you had hoped and planned for the family and for the patient. But I'm wondering what sort of underpins you to do this every day, keep swinging and helping and serving families that are, we're not at our best when we're in your office. We're there because the wheels have come off. Excuse me. The wheels have come off in some way in life with our health. So what keeps pulling you back and keeps you centered and also sane, as a practitioner?
It can be challenging, but seeing that the work that you do, the good work is helpful. And we do have tough days. There's no doubt about that. And fortunately, in my desk, I've got a nice letter file.
Oh, yeah.
And when you have a bad day or have to break bad news to a family, and you know that their day is not going to be better after speaking to you, I'll go into my nice letters file and letters from parents, families, patients, pictures that they've drawn, cards that they've sent, and sometimes just 3 or 4 minutes of going over some nice letters from families can make you feel enough to, I need to go back and do the next patient, the next family, and it can be challenging, but again, how you treat them, how you break it to them, and how you deal with them, it's 5 or 10 or 30 minutes for me, but it's a lifetime for them.
Sure.
So making sure that they feel comfortable leaving.
Boy, you just hit the nail on the head, because I often try to describe what it's like to get a diagnosis for your children. I think it's different. Like, I've never had a diagnosis for me personally that really set my life in one moment in a different path, but I've had it for 2 of my children. And that moment where there's this sharp delineation when you're meeting about your child, there's something wrong, quite seriously wrong. And then you get an answer. But your life up until that particular intersection was one way. And then once we have a relationship with someone like yourself where you're given the news and more information and a path forward, your life's forever changed. And so the weight I would bring if I was in your shoes, it's like, sometimes these are very hard conversations where the life of the family is forever changed. And I don't know if there's anything you want to add to that, but it was just that moment, such a striking thing.
I think when there is a very challenging diagnosis to deliver to a family, before I give it to them, I sit back and say, how would I want them to explain this to me? How am I going to understand this, explain this, and know where to go once I leave the office? Because, as I said, they walk out, I see the next patient, but for them, this is lifelong.
Yeah.
And how you relate to them, how you get them comfortable with the next steps is the difference between their really being able to thrive in life or not. And the more time and effort you spend with that and really connecting with them is important. And it can take some time. But as I said, a minute or two for us is hours and days for them.
Well, you hit the nail on the head. When you feel like your doctor really has an interest in your child or in you personally and has a little bit of that softer bedside, empathetic, yet professional and steady relationship, it makes all the difference.
There was a quote from Teddy Roosevelt who once said, "Nobody cares what you know till they know that you care."
Yeah, I'm going to make a plaque out of that.
But true, no, I mean, they have to. You really have to care for the family and the patient, and sometimes you have to get up close. Sometimes you have to hold their hand.
Yeah.
And really look them in the eye, and sometimes you have to take a box of Kleenex with you.
Sure.
But if that's what's needed, then so be it. That's a small price for us to pay, so to speak, but yet a huge benefit to them.
Yeah, for sure. And well, I admire everyone in the heroes overused and sort of slapped around now on anyone who steps up in their role. The other counterpoint to that is this is what you signed up for. This is what you went through training for, and to be a true professional requires you to be professionally empathetic too. I think it's a standard that any doctor or anyone in healthcare can aspire to, is like how to, as you said, get better every day, not settling.
Well, it's one thing that taught me. I was at Texas Children's Hospital in Houston for 20 years, and one thing they taught you from day one is, what did you do to make us better today?
Yeah, right.
And you think about that after several months, all of a sudden you start driving to work thinking, what am I going to do to make us better today?
Yeah.
And then it's with the whole team is thinking that mindset, all of a sudden great things can happen.
Well, it changes the culture. It makes it a more positive workplace. And I think, certainly, and I don't want to pivot too quickly to the current events in time, but transitionally as chief medical officer, just explain kind of your purview. You're still making some rounds, but you're largely in administration now and management of the hospital. But under your purview, what are your main responsibilities if you're the CMO of Metro Health, University of Michigan?
Well, the chief medical officer's responsibility is to really run the medical care in the hospital. Mm-hmm. So I try to start most mornings through the emergency room, maybe 6 or 6:30 in the morning, talk to the staff, the nurses, the physicians, the therapists, the ward clerks, see how their night went, how the day's looking. And then from there, I usually then go to the preoperative area where everybody's coming in for their surgical procedures, talk to all the staff there, and then upstairs I'll start in the ICU and go to the floors. And it's kind of nice to be there right around shift change because you can hear the nurses were leaving, find out what their challenges were overnight, and then talk to the nurses during the day so that we maybe help address some of those concerns that they will have to take care of. And the nice thing I found that by rounding myself, I can, number one, determine the problem exactly what it is.
Yeah.
Because if I wait for it to come to my office, number one, I'm not sure what it is. It's filtered by 12 people. Number two, it's a disaster.
Right. Yeah.
So if I can take care of it, know what it is, take care of it immediately, or help someone take care of it, then really it's much easier, much prompter. It's better for patient care, and certainly engenders the support of all the people in the hospital, all the staff, and for them to know that their chief medical officer has got their back and is in this with them.
Well, I'm sure you have a nice office, but the point that you spend the first couple hours of your day on essentially a listening tour, is impactful, I'm sure, for everybody, because you're not somebody that they only see when something horrible happened and major changes need to be made quickly. You're embedded with the team, so to speak.
Yeah, too many times an administrator or another suit, so to speak, they show up on the floor, okay, what's wrong, why are they here?
Right.
Whereas, fortunately enough, being there for 2 years, when I'm on the floors, some of the nurses and therapists will come up and say, hey, Dr. Grifka, here's what I saw, or here's what I did, or here's the issue I have. Mm-hmm. So the fact that now they're comfortable coming up to me and knowing I'm there to help work through problems with them and hear their successes too. I mean,
Yeah.
I like that just as much as the problems.
Yeah, and you can interface with some families, ask how they're doing.
Sure.
And, I mean, you get the full breadth of doing that tour from ER to OR to ICU to everywhere else.
I find it quite helpful to do it on the weekends also. Things are a little relaxed because there's not so many scheduled procedures.
Right.
People have a bit more time. They're a bit more open with their thoughts and really can learn an awful lot on Saturday or Sunday rounding.
Where did you learn that? Did you observe that in CMOs you may have worked with in the past? Or talk about just the pivot. I'm wondering, like, just professionally from, going from active just practice. And you mentioned you've done 7,000 or 8,000 heart catheterizations and so many times in utero.
Sure.
And very complicated things. But that pivot from being a primary, spending your time on individual patients, to an individual hospital organization, what did you learn and throughout that pivot in being the CMO of that organization?
I think getting to this point, my oldest daughter, was a great basketball player, and in high school she tore her ACL, needed surgery. So we were in Houston. I spoke to the surgeon who is the lead knee surgeon for all the Houston sports teams, the Astros, the Oilers, the Rockets. But he was telling me and during the exam, he's got pictures on his walls of all the famous athletes he's operated on, and they did this person's knee, etc. And I looked at him and I said, Jim, I have one question for you. On Monday, I need one good operation. I don't care how many you've done in the past, how many great athletes you've done, but can you give me one good operation on Monday? Because that's what I need for my daughter.
Yeah.
He looked at me and said, no one's ever asked me that question before.
Right.
I said, well, I'm asking you today.
Yeah.
He says, yeah, I can do it.
Yeah.
But that kind of changed my perspective, because now whenever I do a heart catheterization on a child, a baby, a newborn, an older child, even sometimes, as you said, a fetus, the most precious thing in that family's life is their child.
Yeah.
And they're trusting me to put these catheters in their heart and do balloons and crazy things. And I just found myself now, after I asked the surgeon that, I have to be more prepared. Now, I can't have a bad day.
Right.
You have to have your A game every day.
Yeah.
And I think when you have that perspective, it just teaches you a new set of responsibility and what you owe it to these families. And just applying that now as chief medical officer is really just, these patients are here because they're vulnerable, they're ill, and they're trusting us with their most valuable possessions. Mm-hmm. And the least we can do is give them our best.
Yeah. Well, I think what your question, I'm really taken with that, because you were a patient and advocating for your child and your daughter at that point. Was she in high school at the time?
Right, yes. Mm-hmm.
So, that having just the courage to challenge this,
famous
world-renowned, famous athletic surgeon to say, I don't give a shit about all these posters on the wall. I need one from you.
Exactly.
And I'm sure you would recognize that same intensity and sort of concern from a patient or their family at the same time. And just one little story, I mentioned to you that Dr. Foodie, who was a famous neurosurgeon in Michigan here, with Spectrum Health at the time. But anyway, I remember specifically, sort of half joking, when he took Faith, our youngest daughter, off for another brain surgery. Right. And I just joked, it's like, Dr. Foodie, I don't want to put any extra pressure on you today. You got your hands full, but this one means a lot to us. And, but just that little probe, little fun, it was something that relieved my pressure. I don't know if he took it. He certainly, sort of smiled and laughed, and I think he appreciated it, because it kind of snaps you into this moment, because I think there's so many procedures and so many patients you see, there's a blur. But I think what you're talking about with this particular surgeon in Houston, you really related one-on-one, and that got him thinking about your daughter's case specifically, at least for a moment, to calibrate.
Well, it did, and it got me thinking after that, every patient I take care of. I'd never really had that perspective before.
Yeah.
But if this was so important to me that we get a great operation, every patient I see, it's their parent, they have the same perspective. It's important for them, for me to do a great procedure, and it just really kind of upped my game. As I owe it to them to really make sure we're continuously doing everything we can to do the best for these patients, and not just for the patient, but then discussing it and educating the family what we did, where we are, and where we will be going. And if you can, as I said, if you can answer, nothing's more important for me when at the end of a discussion with a family, any question, they say, no, you've answered them all.
Yeah, right.
Then you've connected, and they're going to have a comfort level with you, and they'll feel that their child is great cared for.
We've also set the bar, and it's been a long time since we've had to do this, but we often, there's good doctors and bad doctors. We haven't had any bad doctors, but we were looking because our kids were longer term. We knew they needed frequent flyer, so to speak.
Sure.
So having a little more personal touch, feeling I don't need to be your best friend, but I need to like you.
Mm-hmm.
You're caring for my children, and not just because you've shown some empathy and also just some very specific interest. So we always really, my wife Kathy and I were just, if we were getting the care on a keyboard and they would hardly look, and they're just for 5-10 minutes barely looking at your child and just kind of running through a routine of questions, we would request that we are not under the care of that doctor anymore. And that was how important that connection was, because we might only get 5 or 10 minutes of your time. So that point where you feel like that doctor was vested in us for that moment. And that's what you were doing with your daughter as well, and you're that doctor.
Sure. And when I'm in clinic, I don't use the computer in the room. I find myself too geared to the keyboard and the screen. Mm-hmm. I spend most of the time looking at the patients and the family and the parents, and it takes a little longer to get the note done afterwards, a minute or two.
Sure. Yeah.
But again, it's a minute or two for me, but it's an eternity for them.
Yeah.
And to make sure that they've got that comfort level, that they know you're listening to them and hearing everything they say.
Yeah.
And just as with some of our friends are more challenging than others, some patients are more challenging than others.
But yeah, I'm certainly not. I'm sure we were challenging at times, to people and go, oh my gosh, but
you need to connect to all of them, and that's the key.
Yeah.
And some days a little easier than others.
Yeah.
But as I keep reminding the young doctors, no matter how bad your day is in the hospital, when you leave here, smile, because we're going home.
Yes.
And a lot of people here aren't.
Yes.
So if we're going home, we're going to have a good day once we get there.
Yeah.
So just remember that and treat all your patients as best you can, because they're not going to go home tonight, but you will.
Yeah. Well, and that's a great reminder for all of us, as we work through COVID and the pandemic, and just, if we're fortunate enough to either come through it because you had it, but also if you've avoided it to this point, we're all pretty lucky, and there's light at the end of the tunnel. I wanted to ask you specifically about heart surgeries and catheterization.
Sure.
So I'm just fascinated, like what I mentioned with brain surgeons and heart surgeons. The fact, again, I'll go back to there's things I never will forget about that time when she was in critical care and getting brain surgeries. But Dr. Foodie just straight up admitted I was asking all these questions about her prognosis. And, this is an infant. And,
Sure.
He's like, Brian, there's an awful lot we don't know about the brain, And it's a mystery. And we won't know until we know, and I was just wanting answers, just kind of grasping, well, what is she going to be like at 3, and what capacity will she have, and this and that, and a lot we don't know. Same with heart surgery to some degree, I'm sure.
Exactly. No, and the one thing I put balloons in little babies' hearts and put plugs in and rip holes in some kids' hearts if needed. But when I was deciding whether or not to go into this interventional catheterization procedures in little kids, I just talked to one of my mentors who was well-known and very astute, and he said, well, let me ask you a question, Ron. He said, did you get 95% on all your tests in undergrad? And I said, you don't get to medical school. And I did pretty well.
Yeah.
He said, well, did you get 95% on your tests in medical school? I said, no. He said, did you get 95% on your board scores? I said, no. He said, well, if you're 95% successful as an interventionalist, you're going to starve. Because the bar is that high. You have to be better than that.
Yeah.
And there's nothing wrong if you can't, but then you need to find something else.
Right.
Because if you're having 1 out of 20 problems, the patients aren't going to feel comfortable with you.
Sure.
He says, you're the only one who can answer that question. How good can you be?
Yeah. And yet you still leapt into the procedure.
Crazily, I proceeded on that path. Yeah, but but it really just, again, put a lot of things in perspective that, people really expect a great result.
Well, literally at that point, their lives and
Sure.
that patient's lives is literally in your hands, or the instruments that you're working through. And that's the other, is the tremendous advancements in technology, but it's still your expertise. I mean, it's one thing you could give me, some robotic tools,
Sure.
but you wouldn't. It doesn't make it necessarily easier. Maybe there's benefits to this technology, but it's still your mind and your decision-making process throughout every procedure that creates that hopefully 100% outcome.
And, when you inflate a balloon in a little child's heart, for 5 or 6 seconds, there's no heartbeats.
Yeah.
And you deflate the balloon, and you sure hope the heartbeats come back.
Yeah.
And thank goodness with all the great techniques and staff we've got, they almost always do. But there's always that little moment of angst. But that's why you practice, work with great people, and you really are prepared going into the procedure.
Boy, that 5 seconds just conceptually just thought about.
Seems like
you should
forever.
Yes, but also it's like you should write a book around that. The premise of the book is like that, what you feel and what you experience in that 5 seconds. And so many things have to come together that you have a predictable outcome. Otherwise, you wouldn't stop the heart,
And it doesn't matter how many years of schooling you've had, because everybody in that room, all your nurses, technicians, therapists, anesthesiologists, everybody's important.
Yeah.
And no one's more important than the other. We're all the team, and if you're all not rowing in the same direction, it can be even more challenging.
You bring up a good point. I've been fortunate to film quite a few surgeries, and I've been in ORs filming things, and the concert that happens around the table between the surgeon and the anesthesiologist, and there's maybe 10 or 12 people in this room at various times, and it is a synchronous. A lot of people don't get to see that because you're under anesthesia,
right,
and families aren't in there, by your side. So that is really a dance that really requires an experienced team, and I can't imagine how important key people are, where you just link in and you have one director of nursing or whatever the roles are. I won't have the titles right, but that's your anesthesiologist. If you have a preference, you want that particular doc or this nurse assisting you and handing you instruments because you have a shorthand. And I'm sure through 7,000 or 8,000 catheterizations and heart surgeries, you've got an A-team of people that
well, certainly it is an orchestra, and you need to have a conductor, but then the conductor has to have everybody else playing instruments.
Yeah.
And they have to hit all the right notes and chords and go from there. So it's I think there was a coach in Ann Arbor who once said, the team. Kind of trite, but it's true in the operating room, true in the cath lab. I mean, you need to have everybody on the same page, rowing in the same direction, and boy, it can make all the difference in the world.
Yeah. Yeah, it's interesting too that over time then there'd be tense moments and there'd be moments where music is playing and there's just normal sort of everyone's focused on what they're doing, but there's these lighter moments and just this relationship that the patient is there and central to why everybody is there. But there's also it's a workplace, and people are just chatting and doing some things in the midst of a surgery or in between. And
there's so many different perspectives. Some people have loud music, some people have classical music, some people have no music.
Yeah.
And they develop a system that works for them.
Yeah.
And it is quite variable, but then again, and people are all variable. So
did you have a particular music? Were you what were you? No music or a music guy?
Well, I grew up in Detroit, so
Motown,
R&B.
Oh man, you're speaking my language now, Ron.
But Motown's great. I'm a big fan of Bob Seger, another Michiganian. And having spent 20 years in Texas, it's hard not to listen to country music.
Yeah,
so
true.
I would alternate between Motown, country, and some rock.
That's fantastic. Yeah. Were you a Glenn Fry Eagles fan at all?
Oh, absolutely.
Yeah. Anyone. We had a trivia game the other day because we've been doing so much during the pandemic. We're setting up especially on my wife's side. We do it on my side too, but there's a big family on my wife's side. And so we connect all our brothers and sisters and nephews and things across the country. But there was a question about Tom Selleck being from Detroit. And Magnum P.I. always had the Tiger's cat. Yep. And anyway, it's just interesting this time we're in. But yeah, I find, for myself personally, I love Motown, early R&B, some early kind of funk music that emerged out of the 60s and 70s and 80s. That's my primary playlist. If it sounds kind of like retro, that era, I love it.
A couple years ago, I came across a T-shirt. I did not buy it, but I wish I had. It said, I may be old, but I saw a lot of cool bands.
What do you know about Texas barbecue? Were you a barbecue guy?
It's hard not to like barbecue. Yeah. No, it's and if you ever get a chance to have a rack of beef ribs, pork ribs you'll never eat again. But it's the food in Texas has been fantastic. The people are very kind and warm, after 20 years there, I was very happy, but it was just time to come home to Michigan.
Yeah.
Family's here, and this is kind of my roots, and it was just nice to be back. And you see, it's
how long have you been back now? Did you come back from Texas into
2006? We came back.
Okay.
So I was there for 20 years, but now I'm back for 14 years now, and I can run, and I jog often, but I can run in 9,500 degrees, but less than 40, I will say.
Take it indoors.
I lost that a little bit, yeah.
Yeah, well, and then just, I don't know if you have any, I'm just wondering top of mind, because Texas is on everybody's mind with
Sure.
this power outage, but can you imagine trying to practice in Houston with the struggles that they've had? And has it informed your thinking as a CMO up here? What do we do if something weird, terrible happens?
It does give you some emergency process and preparation, as we had with, we had a flood a few years ago that we had to deal with. Now with COVID, we've had to deal with, and this whole personal protective equipment, the PPE. We used to just stock 3 to 5 days worth of gloves and masks and things because we get deliveries 7 days a week.
Yeah,
and we didn't have a big storehouse. We didn't need to, so we use that as areas for other things.
On-time delivery. That's
right.
What you need.
Right. I mean, Amazon, same day.
Sure.
But now we try to keep 3 to 6 months of supplies.
Yeah.
And it's changed our whole thought process, and just our whole emergency preparedness is different. And it's COVID. We hope there won't be another pandemic, but could be something else. And the vaccine certainly is just it's the light at the end of the tunnel.
Yeah.
We're really looking forward to that. But as you said, we're so close to getting out of this pandemic. We need to bear with it just a bit longer. I don't like wearing a mask, but we have to do it a little longer.
Sure.
The social distancing. We're getting there, but don't let our guard down now. We're almost home.
Can you just kind of candidly frame two things for me? One is, what were some of your frustrations about going through COVID and the pandemic that made your life as a medical provider more difficult, as a hospital system more difficult, either attitudes in the public, and I'm not leaning you in one way or another, and then maybe one takeaway that really gave you a lot of hope about just where we're at. As you mentioned, we're seeing some light at the end of the tunnel, but what was your greatest frustration? That purview, and then maybe what counterbalanced that for you?
Certainly, I think masks and other personal protective equipment, gloves, gowns, goggles, just to protect our staff. And they were on the front lines every day. They didn't know if patients were coming in, had COVID or did not have COVID, whether they had symptoms or not. But they gutted it out every single day. But it took a while for us to get enough PPE to tell them, yes, you're safe to be working here with us. Thank you. And that was frustrating to see them going out for a few days or weeks until we got enough personal protective equipment in. It hurt to know I couldn't do more for them.
Yeah.
Know that they were doing for our community.
Yeah, there was a vacuum where help might be on the way, equipment might be on the way, the supplies you might, but you had that moment where you still had to do your job and step up.
Exactly, and most people did step up, and other people were quite taken aback by it. But I can't blame them. They've got lives, they've got families, they've got kids.
Sure.
But to not be able to provide them everything that I think they would needed to be as careful as possible and safe as possible, that you'd walk home at night thinking, I just didn't do enough today.
Yeah. What really was kind of a unique inspiration through this time that gives you hope? How have you improved abstractly as an organization because you're tempered through a particular year-long crisis? Any takeaways from this time?
I think certainly it's helped us work together more. We know that although there's different areas, be it finance or purchasing or nursing or physicians, we're all certainly in this a little more together.
Yeah.
And we all need to make sure we're on the same page, make sure we're communicating well. I think our communication has definitely improved.
Yeah.
Sometimes we'd maybe wait till something got more critical, but now we're a little more upfront and addressing things a little sooner, which is a positive. And just making sure that we're all doing everything we can to take care of each other. Yes, most departments would take care of themselves, but now, maybe I don't need these masks. I can give them to the emergency room or the intensive care unit, or the nursing students need something. So to be able to see the expansion of our thoughts about helping take care of others has really been a real blessing to see.
Yeah. Dr. Hahn, who's your CEO and director, he had popped in here last week for a different photo shoot that I was working on for a magazine, and he was one of some people that are profiled in the magazine. But I said, how's the how's everything going? And I meant more financially, it's like, because I know it came, it's tough. You're spending instead of real time expense, you need to purchase months of supplies. That's millions and millions of dollars of PPE that you're going to have to run.
Right.
So, but he said, we're doing okay, and we're seeing some light at the end of the tunnel as well. But as you go through this, this process of trying to step up vaccinations, and as we record this is later-ish February of 2021. What do you see in terms of the vaccine cycle and when we might get to hopefully 250 million people vaccinated?
Hopefully, I'd like to say it'll be summer.
Yeah.
I guess it was probably last March or April, I said, we'll be wearing masks until Easter of 2021. Mm-hmm. I suspect it may be a couple months longer than that.
Really?
Yeah. But
2022, you mean?
No,
this year?
Yeah.
Okay.
No, I was hoping we'd be done by April of this year, but I think it's going to be a few months longer. Mm-hmm. We've never had to, or even attempted to vaccinate 330 million people before. So, people, there's bumps, and why is it? Well, really, it's not surprising.
Yeah.
This is a major healthcare crisis, the likes of which we've never seen.
Yeah.
Hopefully we won't again, but I think if we do, we're certainly be more prepared.
Yeah.
But we do need to just be patient, and we'd like to give everybody a vaccine today.
Yeah, of course. I'm wondering just if you can speak to the innovation. I know that the fact that there are now several different, very viable, effective, that seem to be effective vaccines, just what you know about science and vaccines and the pharmacology of, I don't even know if that's the right word.
Virology. I know. I've read more about vaccines in the last year than I have in my previous life. So,
but just the system of making vaccines and the companies private ones that were involved, like the fact that they could take this new strain of COVID and create a vaccine within a year and earlier, in production. Is that really one of the Mount Rushmore of human medicine achievement in the last 100 years, or where do you put it?
It's an interesting concept. Operation Warp Speed. What some people are worried that the vaccines were rushed out; they haven't been tested, but that's not the case. They have been tested. What we did differently, which was just something we've never done before, we started once they made the vaccine, and they started testing it. They said, "Okay, start making it."
Yeah.
So while we're testing it, we're making hundreds of millions of doses, so that if after the testing we realize that the vaccine is safe and effective, we'll have 100 million doses to give.
Yeah.
As opposed to starting making it at that point.
Yeah.
Now it was an educated gamble because if it didn't work, they'd have to throw all that vaccine out in a couple $1 billion.
Yeah.
Fortunately, the vaccine did work, and then once it's approved, boom, we've got 80 million doses ready to go.
Yeah, they're in the pipeline.
Completely different thought process, and not tremendously, not changing the science at all.
Yeah.
But just the timing of how we did things.
Well, that's a massive bet. You're going to put all your chips on, okay, this looks promising, these first initial tests. We have to go through some additional time and protocols and whatever you need to do to thoroughly test something. But we're going to act like this is ready to run, and we're going to run as fast as we can with it in terms of stockpiling and getting it.
And how great is it? It's produced by Pfizer just south of us here in Kalamazoo.
It's amazing.
Great. But,
great Michigan story there for sure.
Absolutely.
Then, that's hopeful with the vaccine, and that we may, summer, midsummer, be back a bit to our normal life. What makes you hopeful about the healthcare industry emerging out of the pandemic? Is there any abstract thoughts you have about how this may have changed medicine forever?
Well, I think it was interesting to see how the healthcare systems worked together through this pandemic, and we hope that that process will continue.
Yeah.
Because although there is obviously some competition involved, there's a lot of it we're trying to achieve the same thing.
Yeah.
And how can we really maybe focus together to address some issues? It may be better care for patients who are a little less fortunate. Mm-hmm. We can work together to address them. But nonetheless, I think we really have come together as a community, as have other communities.
Yeah.
But I think West Michigan a little different, and really did do a great job working together to help put clamps on this.
Yeah, I was impressed early on, a year ago or so, these combined messages, you mentioned it's a very cutthroat industry. There's big three. There's Metro Health, there's Spectrum, and there's Mercy Health, St. Mary, or what used to be St. Mary's. And, there's battling, there's billboard wars, there's the marketing wars, there's patient, attraction stuff. But really put that on pause for the community because it was a crisis. Fortunately, we didn't have the wave that we were preparing for. To your point about an educated bet.
Exactly.
I mean, imagine if we'd sort of slow walked, and then the response was what we'd planned, but we'd unprepared. That would have been a disaster.
No, you're right. It was the community did come together. The healthcare systems came together, and we prepared for this big onslaught in March and April, which we really didn't get. Mm-hmm. And then we probably let our guard down a little bit at the end of the summer, and in October, November, we had quite a surge.
Yeah.
And our hospitals were full, all three hospitals, and nonetheless, it was a bit challenging, but I think we've, again, come back together and put things in a better place, and our numbers are looking better, patients are safer, and the vaccine's out, so I'm quite optimistic about 2021.
Yeah, well, good. What advice would you have to people who, I've said it to my kids and other people, I really feel I've made it, my family's made it this far without it. I trying my damnedest not to get it now. I don't want to get it. I don't want to be a statistic. We're so close.
Sure.
And I fear it. I really do. I don't, anything can happen. You don't know what would happen.
It's interesting. The best analogy I can think of is when I was in Houston for 20 years, most years we drive home from Houston back to Detroit, visit family. Yeah. And the closer we got to Detroit, the slower I drove. I haven't gotten a ticket for 1,500 miles. I'm not going to get it the last 30.
Exactly.
But it's kind of like COVID. We've made it so far.
Yes.
Don't let your guard down now. Keep your mask on. Keep washing your hands. A little social distancing. Once we get to herd immunity, we're going to get back to normal living. Yeah. We're going to be able to go visit our parents and grandparents. We're going to be able to travel. Yeah. We're going to be able to go to our kids' games at schools and go to graduations, as you mentioned. But we're almost there, but not there yet. So just please bear with us. Follow the suggestions, the guidelines, and we are going to get there. And the better we follow the guidelines, the sooner we will get there.
I think everybody's tired, and that's the hard part, is you really feel entitled to get your life back, and you've made it this far. And it's easy to sort of relax that final mile when family members or coworkers are getting vaccinated, and it's like, boy, but that's almost when a lot of people are most vulnerable to making that one decision. I'm still trying not to, travel, or I'm not getting on airplanes and things. I haven't needed to, but at the same time, I think hard about, would I go travel on an airplane right now? I think statistically and data says there's probably not a lot of transmission at this point on airplanes. However, it's still more risky than staying at home and doing what we're doing, which is socially distanced conversation. So
I think another analogy would be it's like the fourth quarter of a football game.
Yeah.
We're up by 6. Don't fumble. Don't throw an interception. Don't drop the ball.
Yeah.
We're almost there. It just we just got to bring it home.
Yeah. The team.
Yeah, there you go.
Well, what didn't we cover? We had a great conversation, Dr. Grifka and Ron. It's I'm really pleased with how you shared so much of your backstory. Oh, I want to talk about your daughters really quick because you took a phone call. Your daughter called from France. Do you mind just sharing? I don't know why she's in France. I find it interesting.
She spent 3 years in a convent. Then realized that wasn't for her. But she's now parlayed that into a job working in France. She designs purses for Chanel, believe it or not.
Get out of here.
Yeah, seriously.
What?
Yeah, no, Catholic Central grad of Grand Rapids.
No
Catholic
way,
Central,
that's where our kids went too.
Yeah,
so.
But no, she loved it there. But she's a great kid. She's the youngest of my 3 daughters, and my son is in Chicago. He went to Marquette after Catholic Central.
Wow.
So, yeah.
That's amazing. Yeah. And I have one other friend that lives in France. He's American and lives over there. But I'm wondering, have you been able to visit quite a bit?
Well, not for the last
not
year. Yeah. I guess I was there about 16 months ago.
Okay.
But I was hoping to go last summer. That didn't happen. Probably won't happen this summer, but we'll see. But I do miss her. Fortunately, FaceTime you can connect. And she's got 100%. A little daughter who's 18 months old now, so get to see her.
Yeah, to check in with Grandpa and
exactly.
see how he's doing. I had never been to Paris, and I had I've been to Spain many times. There's a backstory about some friend, exchange student we had that lived with, when I was a senior, she was a senior. Anyway, I was able to bring my oldest daughter, what was it, the spring of 2019. I took her to Paris for a few days. It was both our first time in Paris, and then we went to Madrid for like about a week and a half. And it was fantastic. I spent time with my exchange sister's family. But France, it's such an amazing. So is she in Paris then? Or?
She's just north of Paris.
Okay.
She's been there for about 3 years now.
What do you know about the luxury handbags industry? Anything?
I'm learning a lot about them, but apparently I keep making bad choices. So
she gets on you about your handbag collection.
That she does.
Immerse. Do you have Immerse?
No, I've not taken that path yet.
Maybe you could put in a little request for me.
I'll ask for his wallet.
Maybe a luxury fanny pack for me would be great.
I'll contact her and see what she's got in her stockpile.
I'm sorry, Dr. Grifka, that I had to end on this note. But is there anything low-hanging fruit that you wanted to talk about that I didn't ask you? I mean, I feel like we've had a great kind of cross-section. I mean, the takeaway is that this is a monumental time in the healthcare industry and transformative. It's nice to hear you're optimistic.
Oh, I am. And, certainly COVID has changed everybody's life. And so many things have been made worse by it, but we're heading in a good direction now. And we have learned a lot of things from it. We've learned how to work together more. Mm-hmm. We've learned how to do telemedicine. And that it will help some people. Mm-hmm. Some people still need to have inpatient views, exams, but I think the telemedicine is going to be helpful. We've learned how to improve testing quickly. Yeah. And we learned how to develop vaccines quickly. Yeah. So I think there are some positives that are going to come out of this, and I just hope and pray for all the people whose businesses have been affected by this, that they can come through this all. And I read a statistic that by the year 2030, 80% of the jobs have yet to be invented. Yeah. So I mean, there's a lot of changes for everybody, including healthcare. So this is a great community, a lot of wonderful people in West Michigan. We just need to keep adapting, keep moving forward, and keep making it really the driving engine in the state of Michigan.
Well, I appreciate this conversation and you popping in. It's been really fun and encouraging to hear your expertise and your background as CMO now, and this long career you've had helping were most of your surgeries with children then? Was it all pediatric? That 7,000 or 8,000 surgeries?
The majority were in kids, although I do take care of some adults also who may have had a problem from childhood.
Sure.
So, but the vast majority were kids from 3 hours or 3 minutes old to 20, 30 years of age.
Yeah, amazing. Well, thank you. Stay safe, stay healthy, and maybe one day we'll meet up shopping for handbags.
There you go.
Champs-Élysées.
Ça c'est bien. Very good. Brian, the pleasure is mine. Thank you.
All right, Ron. There you have it. Maybe we'll have an update down the road where Dr. Grifka and I were shopping for handbags in Paris. That would be quite a story if that were to actually come true. Really enjoyed that conversation. That was a nice window into the world of a chief medical officer during this time, this crazy, crazy time of transition. Our entire workplaces and medical facilities are transforming as we speak at speeds we've never really seen before. So my thanks to Dr. Ron Grifka. Openly candid, really wonderful, warm conversation, and I'm just grateful he's in his position as Chief Medical Officer at Metro Health, University of Michigan Health. And I just hope you take some part of that conversation with you forward, and have a great week. Let's go get it, everybody. Take care. The Full Exposure Podcast is brought to you by Metro Health, University of Michigan Health, and Dr. Peter Hahn, in appreciation of the creative and artistic visionaries who enrich our lives through cultural connections.